Um, all right, so yeah, I just gave a brief introduction to what the topic was about today. That's basically what this slide is. So first, we'll talk about things that you can do in high school to prepare for undergraduate and medical school. So this includes like classes you can take and activities that you can participate in.
So during high school, you should continue to explore your interests and think about applying to college. Some courses you might consider taking are biology, chemistry, AP biology, AP psychology, physics, and physiology. It's not something you have to do, but just try to see what you like. During high school, you should also get a better understanding of what you really want to do. Medicine is a combination of working with others and science, and it's a challenging route, so you want to make sure it's something you really want to do. You should also try to get into the best college you can to make it easier for yourself when you apply to medical school. However, keep in mind that getting into a prestigious college doesn't guarantee your acceptance into medical school in the future. Some other ways you can prepare in high school include taking challenging coursework, joining clubs that focus on medicine, doing research at a high school, hospital, or university, and volunteering at hospitals or clinics.
Okay, so hopefully that was helpful for those of you who are going into high school next year or underclassmen. Next, we're going to talk about what you can do in college. So this is a lot more detailed with like classes you can take, and then also tests and different types of experiences as well as connections you should make.
When choosing a major in college, any major is acceptable. What's important is to major in something that you enjoy and know that you will do well in. There is no pre-med major, and there is no preference for science or biology majors. Their requirements are to take all the prerequisite classes and take the MCAT.
Now we'll talk about pre-med requirements. So if your GPA is 3.8, you have a 72% chance of getting it. Med schools look at science and non-science GPAs, so make sure to do well in your other courses, for example, English, not just your STEM classes. Full-time students only need to take 4 classes per semester, which is definitely a lot less than the amount of classes that a lot of high school students take, but it's still important not to take too many units or several difficult lab courses at the same time. And try to have a balance of different types of courses in your schedule. You probably don't want to take 4 STEM classes at once. Calculus is obviously a higher level than algebra or trig. However, if it's not required, it's recommended that you take the easier class. There's no bonus for taking the harder version of a course and getting a B when you could have taken the easier course and gotten an A. Grades are extremely important for med school, and you don't want to jeopardize your GPA for a harder class.
Yeah, and just to clarify, if you do want to take like calculus instead of algebra and trig, I think that's also okay. I think these are just like tips and guidelines that you can follow. So it's not like something you must do. It's just like a tip. And then on the slide you can see the different classes that you should take, and which classes will be helpful for the MCAT. And that's what we'll be covering next. So the MCAT is the medical college admissions test. This is a standardized multiple choice exam that's been used for more than 90 years. It moved from a paper-based exam to computer-based in 2007, and almost all medical schools require you to take the MCAT in order to apply. The MCAT covers 4 sections: biological and biochemical foundations of living systems, chemical and physical foundations of biological systems, and then psychological, social, and biological foundations of behavior, and also critical analysis and reasoning skills. So for the first 3 sections, each section contains 59 questions with 90 minutes to complete them. And the last section is a little bit different. It contains 53 questions in 90 minutes. And you'll basically read passages and answer questions based on the passages and your knowledge of the subject. So there are different guidelines of when you should take the MCAT. If you're planning to go straight into medical school right after undergrad, you should take the MCAT in the spring of your junior year. And so that's why it's a good idea to finish the medical prerequisites during the first 3 year, which is mentioned in the last slide. These classes are inorganic chemistry, organic chemistry, physics, and biology. And the general rule of thumb is to take it for the last time between January and April of the application year. So for example, if you want to enroll in medical school in August of 2025, the last time you should take the MCAT is during the first 4 months of 2025.
On top of trying to do well in school and studying for the MCAT, a student has to make sure that they pursue their interests outside of academics that shows their passion and commitment towards medicine. There is no set of checkboxes that the board checks off for you to gain admission into medical school. Extracurriculars can vary from student to student based on their strengths, weaknesses, and interests in different areas. Research is the involvement in a scholarly or scientific hypothesis investigation that is supervised by an individual with verifiable research credentials. Your research should apply academics to research and studies that will be published, advance the field of medicine and life-saving discoveries, learn how to work in a lab environment and carry on procedures and write papers, as well as gain a mentor for guidance. Your hobbies and outside interests should show overall well-roundedness and personal growth, keep you sane and create new friendships, and help you deal with stress. Clinical experience can involve shadowing physicians, interacting with patients, and volunteering at hospitals.
Clinical experience gives students first-hand experience in a clinical setting working with or shadowing real medical professionals. This is the time to decide if you really want to pursue a career in healthcare. Many students work in medical settings starting in their first or second year of college, so there is time to consider switching career paths. Medical school want to see an interest and dedication. Volunteering or working in a clinic is the best way to do that. They look for students who are certain that they are making the right decision for themselves. Although it isn't required, med schools will often write you off as an uninterested applicant if you lack clinical experience. Lastly, to get connected to a doctor's office, clinic, or hospital, consult your university's pre-med office.
It is important to get to know 3 to 6 professors during your college time so you can get good letters of recommendation for med school. These professors can be known through like courses, through many different courses such as advanced courses, research courses, hospitals, and even doctors' offices. You'll need 3 to 6 of them to ensure the best chances of when applying to med school. Professors who know you really well, even if you're lucky enough to have a family member who's a doctor, will write very, very good letters of recommendation that are very personal to you.
Something crucial in the medical admission process is writing a strong personal statement. You must dedicate a lot of time into writing and editing your statement and put as much thought into it as possible because the medical field is extremely competitive. Some questions to consider include, why do you want to be a doctor? Why not go into another health science field? Why should we take you? It's important to be as genuine as possible with your responses and limit cliches. Now let's move on to the interview process.
The next step is to prepare for your interview, and you can do this by practicing with mock interviews that are provided by the pre-med office. Some key interview questions which you should know the answers to is, why do you want to be a doctor and why do you stand out among other applicants? And again, make sure your answers are genuine and not cliche.
When applying for medical school, you should apply early to in-state public medical schools, and you should also consider applying to out-of-state private schools. So there are 2 key things you should look for when you're applying, and that is whether they accept a lot of out-of-state applicants or whether you would be a competitive applicant and student.
Okay, and then that's it for the college sections. Now we're going to talk about what you can do after college. So this includes like residency and other experiences that you might engage in.
Medical school will teach you a broad range of medical knowledge, basic clinical skills, and supervised experience practicing medicine in various fields. On the other hand, medical residency will give you the opportunity to do in-depth training within a specific brand of medicine. These are the requirements to become a licensed physician. Depending on the specialty, you will need to be a resident for 3 to 7 years. For example, pathology is 4 years, psychiatry is 4 years, and neurosurgery is 7 years. On the job training, you are paid $40,000 to $60,000 per year. And you will also have to work long hours, where you are expected to work up to 80 hours per week. And at the end of residency, you will have to take a board certification exam. And every 7 to 10 years, you will need recertification. This means that you'll have to retake the certification exam every 7 to 10 years to keep their credential. You will also now complete a complex set of requirements every 2 to 3 years or risk losing their certification.
So to summarize, here are your pre-med requirements. So after your 3 years of college, at least, the first thing you need to do good on is have a good score on the MCAT in the following sections: your physical science, biological science, reading comprehension, and sociology/psychology. You also need clinical experience, community service, extracurricular activities, and/or research to help you look good. This can be all of them or a combination, but usually the more the better, because that helps your resume and makes you look more well-rounded. Lastly, you need to do your MCAS application, which encompasses GPA, test scores, letters of recommendation, personal essay, activities, and interviews. This is the part that lets you apply to medical school. Are there any questions?
Yeah, that was definitely a lot of information to take in. So whether you're just going into high school or applying to college next year, or even if you're in your undergraduate years, you can feel free to ask any questions about the slides that we just had. Patrick asked a question about what MCAT stands for. The MCAT stands for the Medical College Admissions Test. Yeah, thank you, Sarah.
I actually had a question. That's okay.
Yeah, go ahead.
What about applying to in-state private schools?
For in-state private schools, I think we mentioned that you should apply early for those, because sometimes people, like some colleges don't really accept out-of-state students. So when you're applying to medical school, I think you get like a small advantage if it's in-state. So that's why when you're applying, you should check whether they accept a lot of out-of-state students. I think these guidelines are, I think they're focused on the US, so it might be a little bit different for other countries like Canada or Thailand. Yeah. And then Patrick wants to be an ophthalmologist. That's really cool. Yeah, I think that's the correct spelling. Yeah. On our website, we have a guideline with the specialties. So it's under our journal, and it kind of tells you like the number of years that you need. So we have like an overview article about like specific specialties in the general path. So then I think whether you want to be an ophthalmologist or any other field, there's like an average salary and then the average length of residency here. So for ophthalmology, the average salary would be 371K, and the average length of residency is 3 years plus one postgraduate transitional or preliminary year. And then it's also here for like different fields. And then a lot of our volunteers also wrote like articles for different specialties, and these are like more specific. Sorry, it's taking a while to load. So you have like dentistry, OB/GYN, and then neurosurgery, and a lot of different like specialties. And then below that, this is kind of on an unrelated note, but we have like medical diseases and disorders and also anatomy. And then these are medical schools. We're gonna publish more soon, but you can learn more about like whether they accept out-of-state students, how competitive they are, what your average GPA should be. And then we also have like animated videos. Yeah, that's kind of on unrelated note. Okay, we have a question. Does your website have medical related opportunities for high schoolers, or can it just be any opportunities to stand out more? I think, well, our website does have some, these are for high school students. Hold on. Okay, so these are academic programs. We have them separated in 3 categories. So academic programs like Aim High, Summer Bridge, and Breakthrough. I think they start in middle school and then they kind of guide you throughout high school. So you can start on those. They like help. I think it's mainly like a summer program that helps. I personally participated in Aim High, so I could provide a reference if anyone needs one. And we have like STEM programs. These are okay. So these programs are for middle school and high school students. And then there's also like research positions for college students, since the careers in science and teen advocates for science communication. If you reach out to the Academy of Science, they usually have research positions every summer. And these are for like students of like all grade levels. And then there's like different departments, and in there there's like there's a genetics lab, and then they do like PCR and different things like that. And so the chief of science there is actually Dr. Shannon Bennett, and she works in epidemiology. So during the COVID pandemic, she played a really big role in helping the academy stay informed and also return. This is a tech workshop for girls, and then you also have the Lawrence Hall of Science at UC Berkeley, which provides a lot of opportunities. And then you also have the National Student Leadership Conference. They offer like opportunities at different colleges for high school and middle school students. And there's also like a couple more like Buck Institute and then Teen Science Night. And then for the medical programs, there's the Stanford iGen mentorship, which kind of focuses on bioengineering and applying biology and chemistry. And then there's the Stanford Medical Youth Summer Program. And this is like, it teaches a lot about medicine. You do like a cadaver lab and stuff like that. And then there's also like Wishbone, Cosmos at UC Davis, Heal. And then, yeah, you guys can feel free to check these out. But it's not like you don't have to participate in any of these programs. It can be any opportunity just to help you stand out more. So like depending on the school you go to, they might have like a partnership with a medical school or a lab or like a hospital where you can do research. So it's not like limited to the programs that we have on our website or what they have at your school. I think what's important is just being able to show that you're passionate about medicine, and that you have the initiative to kind of look for different opportunities. Is that helpful? Okay. Yeah, if anyone has any other questions you want to ask like individually, if it's like more specific, you can feel free to like put them in like direct messages. And then yeah, if you don't have any questions though, I think it would be okay to end a little bit early. Next week we have a dentist, I believe. Is that correct, Liz?
Yeah, she's a pediatric dentist.
Yeah, so she's going to talk about like dentistry and kind of her experience through medicine. So that's definitely really exciting. It's something to look forward to. And this is just our social media information that we put up every session. I mean, you can like watch the session recordings on our YouTube channel. It's just youth and pre-med, so you can like go like search it up on YouTube. But that's all we have planned for today. So I'm okay with ending a little bit early. So enjoy your weekends, your Sundays, I guess. Thank you.